I heard someone say today that there's no depression in Africa. Well, that was a fellow Cameroonian. So I don't know if that was a joke or they were just trying to be, I don't know, just stir the pot to say the least. Are you prioritizing your mental health? Is what I want us to talk about today. So many times, especially living in the diaspora that is away from Africa, there's certain things that we literally take for granted, right? And mental health is one of them. It's not a big discussion back home. However, it is something that we need to take into consideration. There are a lot of things that predispose people to become depressed, especially when their serotonin levels are low, right? Because if you look at one of the most popularly prescribed medication, first line treatment for depression is an SSRI. That's a serotonin, selective serotonin reuptake inhibitor. So they want more serotonin in the system. That kind of helps with mood and keeps depression at bay, right? There are certain things that make us deplete our serotonin levels, like bring them lower to where we become symptomatic, like the depression and the anxiety. And being in a prolonged state of stress lowers your serotonin levels. Eating an unbalanced diet lowers your levels. Some genetic factors are in play, having digestive issues, substance use, drugs and alcohol, hormonal changes, and a lack of sunlight, to say the least, right? We're now in a day and age where most people work indoors. We seldom go outside for like sunlight. We seldom see the sunlight literally. We go to work when it's dark and leave the building when it's getting dark. So we have little to no exposure to sunlight, and sunlight has been shown to be one of the factors or things that boosts our serotonin levels. Okay, I'm going to talk about a few things that can help get those levels up. Physical exercise, physical activity of any sort, exposure to sunlight, like I just talked about, sleep, good sleep, and a circadian rhythm has helped boost serotonin levels. Studies have shown meditation, mindful practices have helped get those levels up. Social connection and social support, massage therapy has been shown to boost serotonin levels. These are all things that are like non-medicinal, non-prescription, non-pills to treat or help boost our moods, right? And I also want us to be a little bit mindful of mental health with the people that we kind of cohabit with, coexist with, our coworkers, our family, our kids, our friends. Be mindful of the fact that they could potentially be depressed or anxious, or like they're not in a position where their behavior or their action should affect our mental health, right? Prioritize you. Depression is not a bad word, right? Many people are depressed. People don't say it. People don't know it. Sometimes it is not a bad word. It is good, a good thing, a good practice. Good, it's good practice. Literally know how you can, what you can do to boost your mood, right? Serotonin is produced in the stomach, right? And like I said in a couple of videos back, we are 80% what we eat and 20% are our genes, our genetics. So if we're eating better, studies have shown that our serotonin levels will be up, right? If we're exercising and being more physically active and more outdoors in the sun, studies have shown that our serotonin levels will be up, and that keeps our moods, keep us more elated, more happy, more, I guess, more less depressed, right? I was I was happy that I heard that conversation. Depression does exist in Africa, especially. People just don't know, want to use the right terminology for it. But we have a lot of people that walk around, even back home, like not really happy. I don't want to use the word depressed. Not really feeling motivated. Can't really go to sleep or stay asleep long. Like they wake up in the middle of the night, a couple of times a night, wake up early. Not really feeling having that drive to do things that they've once found pleasurable. There are little subtle signs that will tell if someone is depressed or not, but I'm trying to keep us away from that, right? If we keep our serotonin levels up, then we will not need to take the SSRIs to keep our serotonin levels up, right? Eat better, diet, exercise, stay away from stress, good social connections, good sleep, meditation, mindful thinking, mindful thoughts, right? Those have all shown really good results in keeping serotonin levels up, keeping us happy. Okay, all right, those are my 2 cents.